Results. After 1 or more weeks on the diet, edema and uremia, the accumulation of abnormal substances in the blood and kidney failure decreased. Their blood pressure fell significantly, and heart failure disappeared. These initial results strongly reinforced Drive Kempner's conviction that kidney disease was essentially a matter of metabolic dysfunction. As he refined and applied this treatment that arose rather casually from his discussion with students, his hypothesis would be dramatically confirmed. Moreover, it soon became evident that his diet was effective in patients with hypertension and heart disease unrelated to kidney dysfunction. As Pasteur said, chance favors the prepared mind. As Dr. Kempner developed it, the rice diet provided about 2,000 calories per day, over 95% of which were derived from carbohydrates. Typically, a day's fare consisted of a small bowl of plain rice with a serving of fresh fruit for breakfast, and for lunch and supper a larger serving of rice and 2 servings of fruit. Fruit juice, served at all 3 meals, was preferred to water because it was alkaline and compensated for the acidosis present in many kidney patients. The calorie content was adjusted according to whether weight loss or gain was desirable. The daily diet comprised 4 to 5% protein, derived almost entirely from rice, 2 to 3% fat, and the rest carbohydrate. Sodium content was 150 mg or less and chloride was 200 mg or less. Fluid was restricted to 1.5 pints daily, to prevent water intoxication, or dilution of electrolytes. Contrast this to the normal American diet of today, which contains 10 to 25% protein, 20 to 35% fat, 40 to 60% carbohydrates, 7,000 mg of chloride, and 4,000 mg of sodium. Dr. Kempner was initially able to enforce the rigor necessary to the diet's success because all subjects were hospitalized. Their diet was entirely controlled by the medical staff, and the duration of the treatment was relatively short. Physiological responses could be closely monitored. When the diets were ordered from the hospital kitchen, however, some of the medical staff were horrified and told the patients not to comply. Some may even have smuggled in prohibited food. Dr. Kempner, usually accompanied by his residents, made daily rounds on his patients, beginning at 6:30 in the morning. He obtained measurements of the patient's blood pressure and weight. Their blood was checked frequently to measure the concentrations of hemoglobin, non-protein nitrogen, total protein, chloride, calcium, and phosphorus. Their urine was checked for protein and chloride. He measured kidney function by intravenously injecting phenylsulfonthalein (PSP) and then measuring the amount excreted in the urine. He also had patients' cholesterol levels measured at a time when scarcely any medical authorities thought there was any connection between cholesterol and disease, or that diet could affect cholesterol levels.